Concerning new research for you this morning revealing how the pandemic is affecting our blood pressure. A recent study found that average blood pressure levels rose significantly from April through December of 2020. That's compared to 2019, no pandemic then. The study looked at nearly 500,000 adults in the U.S., and there was also more of an increase among women than men, also in older adults. The CDC says high blood pressure increases the risk of heart disease and stroke, two leading causes of death here in the United States. Our senior medical correspondent, Dr. Narula, is also a cardiologist at Northwell Health, and she joins us now. Dr. Narula, why the increase in blood pressure? What's the simple explanation here?
Well, simply, we know that so much of your risk of developing high blood pressure or having your blood pressure worsen is based on lifestyle factors. And you can imagine all of our lifestyle has changed in the last almost 2 years. And so while the researchers didn't point to any definitive reasons, we can all surmise that there probably were changes in how we were eating. So possibly more salt consumption, more alcohol consumption. Maybe people were more sedentary, less active, may have gained some weight. Sleep patterns changed. And then a lot of people missed their appointments with their doctors. Or if they did have visits, they were televisits where their blood pressure wasn't being potentially measured in the office. So.
What concerns you most about it? Because a lot of times you don't even know your blood pressure is going up. It's not something that you really feel.
And a lot of my patients say, why do I have to take medication? I feel fine. And that's really the concerning thing.
That would be me, one of your patients.
Yes, one of my patients, Gayle.
Yeah.
But no, the concern is that blood pressure, every heartbeat, your blood vessels are seeing this very high pressure. And it's damaging to the vessels all over the body. And so what it does is it increases your risk for future complications, things like heart attack and stroke and heart failure. And then things that a lot of people don't think about, like vision changes, sexual dysfunction, and kidney problems. And, as you mentioned, Gayle, lots of times it can be silent. That's why we call it the silent killer. You may not have symptoms.
Sexual dysfunction?
Sexual
dysfunction? Yes, is tied to blood pressure?
It can be, yes.
Really?
Yes. So even more reason to get it checked.
Yes.
Blood flow matters. So is that one of the warning signs that there might be
People are listening a little bit closer to that one. What did you say, Dr. Narula? So what are some of those warning signs?
Right. So a lot of people think, severe headaches or nosebleeds. And yes, sometimes that can be a sign, or shortness of breath or chest pain. But a lot of times there are no signs. And that's why it's really important to start having your blood pressure being checked at the age of 20. That's really what the American Heart Association recommends. Right. That's really early. And to have it screened annually if it's normal, and possibly, more often if it's not normal. And, I think one important thing is to know your numbers. And a lot of people get told, oh, your blood pressure's fine. But actually, it's not fine. And when they come to see me, I say, well, it's pretty high, actually. And so a normal number is less than 120 and less than 80.
Okay.
Anything
less than?
Yeah. So 120 to 130 is already elevated for the top number.
That's big.
Yeah. And high blood pressure over 130, over 80.
Any holiday recommendations for managing one's blood pressure?
Right. So make sure you bring your medications. Make sure that you try to stay as active as possible. So even if you're on vacation, try to look at how much salt you're consuming. Avoid adding salt, and really read those labels if you can, if you're purchasing
holiday
things.
dinners and alcohol consumption goes up this time of year.
Exactly.
Right.
So something else to pay attention to. And then stress, right? A lot of people are under more stress when they're around certain family members. So.
And you're not trying to be a buzzkill. You're just trying to keep us happy and healthy.
That's right.
That's very important information here.
Enjoy your holidays, but also be mindful that it's not just a vacation from your health. During this time, you got to pay attention.
Tara, thank you so much. Know your numbers.
Yes.
It's great advice.